side, and we will have an introduction by the chair of the board of the Anacostia Coordinating Council in 1 minute. The baby formula crisis is a crisis that is not very recent. It's actually been going on for months. I will be sharing some background information after the chair of the board of the Anacostia Coordinating Council makes an introduction, and I will share with you the background information on the issue of the baby formula shortage. We will be joined today by many different people to give perspectives about this project, about this meeting, and about what's going on. First and foremost, DC Council member and Ward 1 Council member and chair of the DC Council Committee on Human Services, Councilmember Brianne Nadeau. But we will also have other pediatricians, doctors, and mothers that will be weighing in as well on this issue. And so I'm going to make sure that we're going to do make sure that I do a time check and that we get the business done as quickly as possible. So without further ado, I'd like to introduce Lamont Mitchell. Lamont Mitchell is the chair of the board of the Anacostia Coordinating Council. Lamont?
Thank you very much, Ambrose, and we are happy to co-sponsor this very, 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 very important dialogue tonight. On which I would say, and of course, you know, Ambrose, you're in the Health Alliance and this other politician there, but I would actually say that, you know, this is a man-made shortage. And I'm quite sure you'll talk about, or somebody will talk about the political implications of this particular shortage as we go along. And I just want to say we're happy to co-sponsor this event because it's so important. And you know, we shouldn't have to be here, Ambrose, and I know I got a couple of minutes, and we shouldn't have to be here because this is one relating back for me, just for me, one of the most, you know, hideous things to happen because the nature of the greed of the corporate America and the way this formula is made and the price, the way it's set, and the way only a few companies make this product is really ridiculous, and it's a formula for disaster if we don't begin to look at it from a political standpoint and begin to look at some of the reasons why this happened in the first place. It's going to happen again, and it's just unadulterated greed on the part of American business and political politics playing amok. And I'll just say this in closing, and thank you for this very, very important discussion, because to have it so, the U.S. government to have it so that this vital formula cannot be imported from Canada without this crazy tariff attached to it is absolutely ridiculous, and it needs to stop. And it's causing an artificial crisis where there shouldn't have to be none, as something as critical as baby formula to us here in America. So I thank the Alliance for sponsoring this forum. I thank Phil Pennell and you for working on it and getting it out on this short amount of time. And I think it's a discussion worthy to have because people's lives are at stake. Black and brown people's lives and babies' lives are at stake because of the greed and the recalcitrance of this particular government. Thank you. Thank you, Ambrose, for it.
Thank you. And Lamont, before you go, just share with the people who the Anacostia Coordinating Council is and how important you are to the communities in Ward 8 and east of the river.
Great. We are a 35-year-old consortium of 85 organizations east of the river, and we're in the information gathering and sharing business. We do all things good and positive east of the river. We bring together on our monthly meetings organization heads and individuals from 85 organizations east of the river for a time to share information and to talk about the issues and the things that affect east of the river, particularly Ward 7 and 8. On next Tuesday, I think, is our meeting, the 31st, and the mayor will come in and update us on her yearly trip to ACC to talk about the issues as it relates to the district and what's going on. in the district, and we'll have a hour with her on next Tuesday, not this Tuesday, but the following Tuesday. And we've been doing it under the wonderful leadership of Phil Pinnell. And we've been doing it for a while, and we collaborate with organizations such as yours and many, many, many more east of the river on things that's good and positive for residents in the way of life east of the river.
Thank you. And I certainly hope that one of the issues that the mayor covers is going to be on the baby formula issue. I happened to see the mayor at an event in Ward 8 about probably 10 days, maybe 12 days ago, where she was introducing the behavioral health, mental health hotline over there at Hillcrest Children and Family Center. And she was asked that question by one of the reporters, and she weighed in terms of what the city is doing. So I'm hoping that she talks about that at your meeting, Lamont. And certainly, if you all aren't going to bring it up, I'm certainly going to raise the issue, because one of the things that is a part of that is the stress that it is causing mothers, new mothers, and mothers of infants under 2 years old. The stress that it is causing, and Dr. Barbara Bazron was there. And is this going to result in more trauma and behavioral health needs of mothers that find it difficult to locate and secure baby formula? Okay, so thank you, Lamont. I appreciate it. I want to go into some background right now in terms of this issue. I'm gonna read from a couple of articles that have come out over the past week or so. And I'll start with the first one. Federal officials this week, which was last week, laid out steps being taken to address the national baby formula shortage, which is escalating in Maryland and in the DMV. The shortage is in large part because of massive Abbott Nutrition recalls of popular Similac, Alimentum, and Elecare brands of baby formula. The head of the nonprofit Mom Cares, which supplies baby care essentials to Black mothers in Baltimore, is worried about mothers who don't have the option to breastfeed if they can't find baby formula. Mothers searching for formula are taking drastic measures, including diluting the formula or making their own. Those are measures doctors warn parents not to do. Maryland's WIC program, and I know that this is an article focused more on Maryland. We will have later on today representatives from DC Health and the WIC program for DC. But the Maryland WIC program updated the state website and social media in addition to emailing healthcare providers directly about the alternatives to the recalled formula. In the first week of May, baby formula out-of-stock rates were up 43% from 40% at the end of April and 30% at the beginning of that month, at the beginning of April. More than half of states reported out-of-stock rates between 40 and 50%. So half of the United States reported out-of-stock rates between 40 and 50%. The U.S. Food and Drug Administration said it is working to resolve the infant formula shortages that started almost a year ago due to supply chain issues. Until supplies can be replenished, parents who can't find formula are urged to work with their local food banks and pediatricians. The recalled baby formulas were produced in Sturgis, Michigan, at Abbott's largest manufacturing plant, which was shut down in February due to contamination concerns. Formula produced at the plant was linked to 2 infant deaths, prompting an investigation by the FDA and Centers for Disease Control. The recall especially hurt parents who rely on WIC, Women, Infants, and Children, a special supplemental nutrition program. Abbott brands are among those covered by the WIC program, and the company's woes have trickled down to consumers. Among the solutions the agency is exploring are streamlining paperwork and opening the door for more baby formula imports. And I'll get to a report that's more recent about the import of baby formula. It is a particular worry about parents doing substitutes or trying to stretch the formula out. Dr. Diaz, a pediatrician and associate professor at Yale School of Medicine, And she said, and there's a couple of worries there. One, your baby may not be getting enough nutrition if you're not giving them all the calories that they need. So stretching it out by watering it down will have some effects, and we'll be hearing from pediatricians today. Another thing is that babies, when they're little, and this is something that we need to be aware of as well. Babies, when they are little, their kidneys are not mature. And for that reason, they need the perfect formulation. Otherwise, it could actually cause them to get very sick and have to come to the hospital. Pediatricians say breast milk is best for infants, but if that's not an option, formula is the best option. And to address the shortages, Chicago-based Abbott is increasing production at its other manufacturing plants and is bringing jet loads of formula from its plants in Ireland to the United States. President Joe Biden is taking action amid the nationwide baby formula shortage. Last Wednesday, he announced that he is invoking the Defense Production Act in an effort to improve baby formula production in the U.S. In addition to that, there's another program that he instituted, which has thus far imported 78,000 shipped baby formula items to the United States, including one of the baby formulas is called Alpha Amino, which is an amino-based formula. One of the things that is of concern that I'll raise is the inspection, the quality inspection of the FDA for the Abbott Industries plant, and how often or lack thereof of the inspection for contamination by the FDA. Okay. The Defense Production Act that President Biden acted gives the government the ability to require suppliers to direct needed resources to infant formula manufacturers before any other customer who may have ordered that good. And that's important. It kind of moves those that are in need up to the front of the line. The other operation that he enacted was Operation Fly Formula. I just mentioned that, which is speeding up the import of infant formula. Now, DHHS, that's the Department of Health and Human Services, will send airplanes overseas to pick up infant formula that meets U.S. standards so we can get it on the store shelves fast. And the president has directed his team to do everything possible to ensure that there's enough safe baby formula and that it's quickly reaching families that need it the most. One thing I also wanted to share with you is this last article. And the last article is about, it came from, and this came out to yesterday. And this is from the Abbott CEO. The CEO's name is Robert Ford. And in Sunday's, it came out in Washington Post, he apologized for his company's recall that heightened the nationwide baby formula shortage and detailed steps taken to supply more products in the coming weeks. He said, "We're very sorry to every family we've let down since our voluntary recall exacerbated our nation's baby formula shortage. I have high expectations of this company, and we fell short of them. The baby formula shortage is worsening each day, with reports showing the out-of-stock rate hit a high of 43% for the first week of May. And as I reported earlier, it has gone in some states up to 50 and beyond 50% of the shortages. We know that some children have been hospitalized because of the lack of EleCare, a specialized formula for children who cannot digest other formulas and milks. I will not mince my words," Ford says. "This is tragic and heartbreaking, and it is consuming my thoughts and those of my colleagues. Our highest priority is getting babies safe." So that gives you a little bit of background in terms of this issue and what has been happening. But we're going to be turning right now to Councilmember Brianne Nadeau, Councilmember Ward 1 and Chair of the Committee on Human Services for the DC Council, and to give us an update on her thoughts and what is happening with this crisis, and how the city is responding to this crisis. So I want to introduce Councilmember Brianne Nadeau.
Thank you so much, Ambrose. Truly appreciate you inviting me tonight. It's whenever we talk about issues that impact kids and I'm literally stepping away from bedtime to do it, it really drives the point home, right? My two little ones running around upstairs. I really thank you for inviting me to participate in this conversation, and it's an honor to be here. But I want to start by acknowledging the women who are joining me in conversation tonight. Doctors Bodrick, Prayler, Hancock, Long, and Nash, thank you for all the work that you do for district families. There's nothing that government can do to replace the relationship between patients and providers that form in the clinic, and I see and appreciate your work. I am a mom with 2 kids under 5, and both my children needed formula at the earliest stages of their lives. When I see formula prices in stores go up 30 or 40% or more, and when I see $200 cans of formula online, I'm outraged. And that's why earlier today, I introduced the Infant Formula Consumer Protection Emergency Amendment Act. My legislation would allow the Attorney General to go after people who are charging unfairly high prices for formula. My hope is that we would see an immediate drop in prices, and that anyone who's been stockpiling formula, hoping to see prices keep going up, will get the message it's time to sell or donate those products, because we're not going to let you take advantage of people's desperation. Now, if my law passes in a couple weeks, all of us can be watchdogs to keep formula prices down. If my bill becomes law, you'll be able to report price gouging for formula to the Attorney General at 202-442-9828 or consumer.protection@dc.gov. And I'm going to ask Dan Passon in my office to go ahead and put that information in the chat while I'm speaking. I certainly would encourage anyone here and anyone to do that, to help us by reporting these issues. So I'm going to continue to do all that I can to make formula affordable and accessible. And beyond that, I can share what DC Health has told district families time and time again. Don't dilute your formula, follow the instructions on the can, and do not make your own. We've got to keep our babies safe and healthy. And additionally, I've been active in making sure that DC Health keeps formula as accessible to WIC recipients as possible. So if you do receive WIC, go to the WIC website, dcwic.org, or call your WIC clinic right away. There are substitutions available, and you can't get absolutely all formula, but you can get more formula varieties from all the major companies through August 31st. And if you have an eWIC card, you can put whatever formula is available at the store in your cart, call your clinic from the store to change the formula, charge the formula on your card. Finally, I'd encourage everyone struggling to maintain their mental health during these painful times to reach out for help sooner rather than later. Every sacrifice we make for our children, we carry in ourselves. And everything we carry alone for too long takes a toll. Earlier this year, I supported the creation of a maternal mental health task force that will become a reality in this year's budget. We're going to find out how best to support new moms and get them the resources we need. And I look forward to being a member of that new committee. Many of the resources we will be directing people to, though, are available right now, regardless of what insurance you have. If you need help, you can reach the Department of Behavioral Health hotline at 1-888-793-4357, 24 hours a day, 7 days a week. They can connect you to care and support no matter what situation you're in. For now, take every opportunity to rest and show the same care for yourself that you show to your family. I promise I'll do what I can to make that easier. Thank you, Ambrose.
Thank you, Council Member. And I'm going to open up the floor to questions for the Council Member. But I wanted to start by asking, is this bill going to be fast-tracked? Is there a way to maybe get it passed under emergency legislation, given, what is it? Can that happen?
Yeah.
What is your timeline?
Great question. So bill was introduced unanimously with 13 members. I talked to Chairman Mendelson today. He said that he plans to agendize it on the June let's see, hold on. What month is it? The June 7th meeting. And I'm scrolling through my calendar and Dan is sending me a text so that I don't have to do that anymore. It's good staff work. In any case, yeah, so the June 7th meeting, and it's an emergency bill.
It is, okay.
And we worked with the Attorney General on it because they wanted the ability to do this really to fight for our residents, right? But we have to give them the authority to do it. So that's the plan. It's not controversial with 13 people introducing it. That's the highest number you can get. So
yes. that is, and kudos to you for introducing it and getting all 13 members of the council to sign it and to move it forward in emergency legislation, because this is going to be so needed. And also for those that are out there, again, because people are beginning to hoard it, and you're finding on the market resellers, you're finding those that are selling it at high prices. And with inflation around the country, there's an issue of price gouging. And so we want to be able to put a stop to that, because we want the access for many of our mothers who need it. I do see a hand up with Reverend Motley, and if you do have a question, please raise your hand. Reverend Motley, if you can unmute yourself, you can go ahead and ask your question.
Yes, good afternoon, good evening. I'm Ambrose, and thank you for this conversation tonight. I'm here on behalf of the Center for Racial Equity and Justice under the leadership of Pastor George Gilbert Jr. Madam Council Member, it's good to see you. Question: do we have an emergency with the production of formula?
Great question. So this is not my area of expertise. Good to see you too, or hear you, by the way. But my understanding is that because we have certain brands that have been recalled and certain factories that are being examined because of that, that we have some issues with formula in the US. But President Biden has arranged for formula to arrive from abroad. And I believe the first plane landed today. The factory is going to be back up and running in a few weeks, but it's going to take several weeks to see the effect of that, because we've, of course, in the meantime, had this shortage. So it's a challenge, but it just kind of, I don't know, maybe there's a political thing here, but we get really used to our own products and sort of isolated sometimes. And we forget, there's other countries that produce things that are nutritious as well. We get used to the brands. I know when my baby was little, well, both of them needed formula at one point, and your kid gets used to the brand. It may be a brand that, works best for them. Maybe one makes their stomach upset, but you find the one. And even when there isn't a shortage, if you don't have what you need, let's say you run out to CVS to get the kind you need and they don't have it on the shelves, and it's a panic, and you're running all around town. And I've done this even without a shortage, running all around town trying to find the one brand that your baby will take, because that's the only food they have. And that's the situation that parents are in right now. And so we're trying to get them something that will be equally good for their kids, knowing that babies need certain kinds of formula depending on what their dietary needs are. So really so proud that our president has stepped up and has, with his diplomatic ties, allowed some extra shipments to arrive until these factories get up and running. But yeah, those recalls really set us back.
And can I have a follow-up question,
yes,
Ambrose, with the council
ahead.
member? Madam Council Member, on the store shelves where the formula is supposed to, there could be some type of directive printed so that families would know what the do's and don'ts, that because I'm hearing a lot of different conversations about this formula or lack of formula and homemade formula. So is there something that maybe you could do from your committee to make that happen?
We'll definitely talk to DC Health about that. They've really tried to get the word out using the local news and forums like this. And I think, right to the source is always a good idea as well. So thanks for that suggestion.
Yes, absolutely. And thank you for that question, Reverend Motley, because one thing that is very important is to get this information out, the do's and don'ts to mothers. I know that WUSA published it. There's also what are called refrigerators. There are entities and organizations that have what's called refrigerators. There have been more than 100,000 bottles of Enfamil baby formula that will be distributed between 10 sites. I have the listing of the sites, and I will be sharing the listing of those sites shortly. But there are places that have where you can pick up for free bottles of Enfamil baby formula, and so that's happening around the city and in Maryland. If anything, I think they need to have. I see that there are 3 sites in the District of Columbia, and there needs to probably be more sites in the District of Columbia. I also see Cheryl Peekball, who has her hand up. If you could go ahead and ask your question and unmute yourself, Cheryl.
Thanks very much. My questions relate to the availability of breastfeeding support and breastfeeding coaching within the DC area, and whether or not there are adequate lactation consultants, because I was very happy to hear Mr. Lane say at the outset that this is a man-made crisis, an artificial crisis of sorts, and highly preventable. And certainly the main way to mitigate at this point the crisis is to support those new mothers and babies in their efforts to breastfeed. Because as we know, breast milk is really the ideal nutrition for babies. And so what I am quite concerned about is that we don't hear about the reality that this crisis is upon us, not just because of the capitalistic greed and political factors, but also you can go back to the lack of support and assistance that young mothers, new mothers get in hospital. So the question really is about DC hospitals and that area, whether there are adequate supports, baby-friendly hospitals and lactation consultants to assist new mothers. And then finally, whether if, for mothers who already have babies and are not in a position now to breastfeed, can they turn to hospitals for formula, particularly for the really specialized formulas that some babies need who have medical disorders?
I'm sure those are good questions. Before I go to the council member for her answer, just wanted to let everyone know that we will have a representative, and actually she's on now, Dr. Michael Young, who will be representing the DC Breastfeeding Coalition. I had also asked Dr. Sahira Long. She couldn't make it because she got a vaccination for yellow fever and one other, and so she's feeling a little under the weather right now. And so Dr. Michael Young, who I talked to earlier today on a program on WPFW on maternal health, will be sharing a little bit later. But Councilmember Nadeau, those are good questions, Cheryl, especially about the availability of specialized formulas at hospitals.
And I certainly don't want to speak about it as something that we have an expert speaking on next. That's never a good place to be, but I will say a couple things. So first of all, I don't really know I'm not sure about the hospitals. I know when I was in the hospital, they gave us formula, it was plentifully available at the time. But I'm not sure about the specialized formula. I think it probably has to do with what your children's needs are while you're there. But for WIC recipients, the first call to make is always your WIC clinic. And, I think I don't want to, I don't want to give you an answer on the spot about hospitals not knowing the right answer. But, I'll say this. We absolutely need more supports for mothers for so many things. And breastfeeding is one of them. I felt really lucky when my first daughter was born. She was on Kaiser. I was not, but she was on Kaiser. And they had a lactation consultant that was working with me as her mom, not even as the policyholder, to help me get her fed. And those supports were really essential. They worked with us because she was a bilirubin baby. Actually, both my kids had to be on the Billy blanket and under the Billy lamp right after birth, and pushing those fluids was a really big deal. But, you know, at the hospital, they're so worried about your bilirubin count that they don't know they want to push formula on you when you're still producing milk and you're trying to get your baby to latch and do all that. So I do think we still need more supports in that area. That said, there are many, many reasons that a person does not breastfeed. And certainly, you know, we don't say breast is best. We say fed is best. And there's a reason for that. And that is because it's not only about like a choice a mom is making, it may just be that formula is the right choice for a mom or their baby or whatever the situation is. So I breastfed both my kids for a year plus. And of all the things I've done in my life, including being council member, doing that is still one of the hardest things I've ever done. And I have a helpful partner. I am the boss at my job, so I can pump wherever I want to and make my schedule the way I want it to. I have access to whatever resources I need through my insurance, and it was still hard for me. So I say, I can't wait to hear about all the work of the Breastfeeding Coalition, but I can say that I've worked really closely with Metro DC doulas, organizations in the community like Mama Toto Village are working really hard to provide these services in community. But we just have to acknowledge that not everyone can breastfeed. And certainly if you're already doing formula and you no longer are making milk, you're in a pretty tough situation right now. I also think it's really wonderful for those who donate breast milk. I never made enough to donate it. I was what they call a just enougher. For those of you who've nursed before, we made just enough for the next day every day. And the stress of like, am I going to produce enough for my baby tomorrow is also compounding. So, you know, as we have conversations about supporting mothers' mental health, you know, the health of the baby, we need to keep all those things in mind and know that fed is best. And I'll say too, the other thing that I've been working on over the years, and that I think we might actually get some more momentum on soon, is expanding our home visiting programs from prenatal even. And I was able to create the DC's pilot of the Nurse Family Partnership, which works with moms before they give birth and supporting them in better health and educational outcomes for kids, but have also increased funding for all of the other existing home visiting programs we have here. But I would like to see universal home visiting here in the District of Columbia. And I did introduce a bill to do this a couple years back. I created a pay for success model because it's such a remarkable intervention that, you know, the idea of leveraging philanthropic dollars on it is, to me, just so smart. It was a little ahead of its time, that bill, let me say. It did not make it out of committee. But I think it's all those supports that go into it. So I meandered a little bit. I apologize for that, but it's lovely to just be in this group together. So thank you.
So let me ask first if there are any more questions for the council member. Just raise your virtual hand or come off your mic and say, I'm ready, Ambrose. I'm a little informal here. It's okay. So if not, I want to go ahead and thank the council member for coming on. And if you could stay on for as long as you can. I know you have 2 little ones at home. We have some other mothers that have little ones at home as well. So, you know, I know how it is. And, you know, my 8-year-old is running around behind me. He can pop in my room at any minute. And so I understand how it is. But as a mother, I don't understand how it is because, you know, it's just so much more that is asked of and required of mothers. And we as men need to be able to support that. And that's important as well. And so, and I'm hoping that at some point we can talk about your maternal task force. That is also very critical. And we can certainly bring you back to that because they're interrelated, quite frankly. As we really talk about supports for mothers, there was a conversation, as I mentioned earlier, on the radio this morning about the maternal health of women. in the District of Columbia, and what exactly is needed. I know that there is the new hospital that's being built in Ward 8, and we're curious as to what are going to be the mental and the maternal health services that will be at that hospital. So I will circle back with you on that, council member, and we'll move forward. So thank you so much for being on with us. One more chance for anyone that wants to ask a question. Otherwise, I'm going to bring up Dr. Nia Bodrick. Nia Bodrick is with Children's National. I've known her because she used to be, and I say used to be, at Unity. And I know her for the work that she has done as a pediatrician on childhood obesity. But she is now at Children's National, and she's doing such great work there. So without further ado, Dr. Nia Bodrick.
Thanks, Ambrose, and thank you, Councilmember Nadeau. I appreciate being here with you all tonight, and I see we have a fantastic lineup, so I'm not going to speak too much about WIC or breastfeeding because I know we have some experts that will be on the call, but I do want to just spend some time giving some advice that I would like to share based on recommendations from the American Academy of Pediatrics and some of the things that I'm seeing in clinic. I practice at Children's National at the ARC in Ward 8, and like many other pediatricians in DC and around the country, we're getting a lot of parents coming in who are spending all day driving around trying to find formula and who have lots of questions about formula and what's safe and what's not. And so I kind of just put together a list of some things that we can share, and I can actually drop in the chat a really great website for you all to share with families. But I just want to go over some things that we would recommend that parents not do, and then some things that you can do. And like I said, I'll leave the specifics about WIC formula substitutions and special formula and breastfeeding to my colleagues. So essentially for infants, as many of you know, for infants who are under the age of 1 who are not exclusively breastfed, infant formula is the best option. And as we've already mentioned before, in regards to the don'ts, we don't want to dilute the water when mixing the formula, which is something that I haven't actually had any parents tell me that they've done, but I can imagine that, you know, desperate times call for desperate measures. And that may be something that you would think you could do, because usually when you want to make things last a little bit longer, you kind of water them down. But with formula, when you dilute the formula, you can also dilute the levels of protein and minerals that are in the formula. And this can lead to very low sodium levels in the blood of babies and other kind of electrolyte disorders that can make them really sick and cause them to be hospitalized. And so in general, that's 100%. Do not mix or do not dilute the formula with water when mixing it. Also, not to make your own formula, which I think everyone has heard that messaging. There's many risks to the infant, including the risk of contamination and inappropriate nutrients. And I know this has been done in the past, but many infants were also sickened by drinking homemade formula. It can also be tempting to share breast milk with friends and from other online groups. And it's best if you're going to have donated milk to get it from an accredited milk bank. And I can drop a link for that if that's not shared, because there's very rigorous standards that need to go through in order to share breast milk. And in general, the American Academy of Pediatrics does not recommend introduction of cow's milk or plant-based milk earlier than the age of 1. There is a little caveat here during this emergency that we're in, this emergency of the infant formula shortage, that if your child is closer to the age of 1 and you're completely unable to find any formula, so say your child is maybe like 11 months or 11 and a half months, I would advise talking to your pediatrician or advising parents to talk to their pediatrician or their primary care doctor about early introduction of whole milk. And if that is done, it should be pretty time limited to no more than a week. And that's because early introduction of cow's milk can cause anemia in infants under the age of 1, which can cause other problems. So in general, we caution against introduction of cow's milk prior to the age of 1.
Dr. Bodrick, that's a very important point. Not introducing cow's milk. There are some, and I've read where some are introducing even goat's milk. Is that the same for goat's milk for infants under 9 months?
Yeah, for infants, in general, for infants under the age of 1, no cow's milk, no goat's milk, no plant-based milk, like soy milk, not soy formula, that's different, but like the kind of soy milk that as adults drink, we would not offer that. And generally would not recommend that to infants under the age of 1 because it just doesn't have the proper nutrients. But as I said, if your child is a little bit older, usually we introduce solid foods at around 4 to 6 months. All the nutrition that an infant gets does not come from the solid food. They still need that formula under the age of 1. But we have a little bit more wiggle room. And my recommendation is just to have a conversation with your primary, give them a call or get on the patient portal and ask, is it okay if I give my child whole milk? More than likely, they're going to say either across the board no, or they're going to say yes, but no more than a week at a time.
So I'm going to segue into something else, and I know that the council member is still on. When we were doing some work, and perhaps you came across this too, when we were doing work on sugar-sweetened beverages, and the Health Alliance Network looked at products in stores and how many of them actually had added sugar. We also looked at baby formula. And baby formula also has added sugar, which was a surprise to me. And I actually went into the Safeway and looked at all the baby formulas. There was one formula that did not have added sugar. But it's not, when you say added sugar, it shouldn't raise an alarm and say that that's detrimental or that's not good for a baby. I was just very surprised to see that there was even sugar even in infant formula. But I wanted to ask you about the dilution of infant formula, more specifically, and whether or not I'm reading and hearing that could contribute to seizures. Is that how that goes? And how does that work?
Yeah, thanks, Ambrose. So yeah, like as I mentioned, that diluting it actually changes the ratio of elements or minerals that are in the formula. Primarily, we're thinking about sodium. So if you water it down, that can make a baby hyponatremic or have low sodium or another electrolyte, and that can cause them to be very sick and to have seizures. And so in general, we say not to dilute it. I can't speak as much about, and I see Elandra has her hand up, so I'll let her speak, but I did want to also caution against parents buying formula online from other countries. The FDA has separate regulations in other countries. I had a mom the other day bring in a formula from England. I think it was from England. And the first ingredient was whole milk. And the second one was sweet cream. And then there were a lot of other things. So there was a lot of sugar. The baby had gained a lot of weight. And I was like, can you just show me this formula? And it was a lot of extra calories and added sugar. And that was all she could find. And so she had been, looking for, and this is before WIC had made their formula substitutions and things so she wasn't able to get the formula that she had on WIC. She wasn't able to find any to pay out of pocket. And so that's what she had kind of resolved.
That's important to note, even though, as I mentioned earlier, the president's plan, they have already shipped in 78,000 units of infant formula from abroad. And I agree. And I've been telling families that, but to still kind of buckle up for another 6 to 8 weeks before that actually reaches the shelves, just to be prepared. And I know it can be hard, but we're asking, especially older parents of older infants, not to stockpile. In general, the recommendation is, 10 to 14 days at a time, even though I know if you find some formula, you're going to want to make sure you have enough for your child. And that's just because we're in a rationing phase. I have some new moms who are, I know we had a conversation about breastfeeding, but are breast and formula feeding. And as all recommendations, I recommend all families, I recommend to offer whatever breast milk they have first, whatever they have, and get them linked into lactation support.
immediately so that they can feel supported with that, and to continue breastfeeding that child for as long as is mutually, what both baby and mommy want, and generally recommend for at least the first 6 months, if not the first year. And for children who are not, because there are some children who are on specialized formulas, and I know that Wick will talk a little bit about that, because those are infants who can get incredibly sick, and they are not able to take to mix and match formulas. For most healthy full-term babies, they can mix and match the formulas. They can have Enfamil or Similac or whatever store brand, but for some babies that's not the case, and so parents will want to work really closely with WIC and or their pediatrician because there is a workaround to get that specialized formula.
Thank you, Dr. Bodrick. I'm going to open up the floor for any questions for Dr. Bodrick. I thought I saw Dr. Hancock raise a hand.
I did.
Of course. Okay, so Dr. Landra Hancock, how are you?
I'm good. I apologize for not officially being able to be on the program. I had daughter duties and dropping my mother off so she can fly back to Louisiana, but I'm now free to be in the meeting. One of the things that's important to understand is for little babies, their kidneys cannot concentrate their urine, meaning when they drink more water than their systems will be able to adjust for, their kidneys can't either make their urine with more water or less, in the same way that little ones 12 months and older can. So as you guys can imagine, when you drink a lot, your urine looks pretty much like what you drank. And if you're not drinking enough, it'll look dark like apple juice. Babies don't have that capacity. And so they end up getting full off of a diluted formula, which does two things: decreases the amount of nutrients they're able to absorb because of the less nutrients available, but it also dilutes out their little systems, and their kidneys can't pee that extra water off. And so that's the underlying reason why we end up seeing them have this low salt level that then facilitates seizures. And this is something, it's not a theoretical risk. I've taken care of babies who've had diluted formula because parents were in a financial bind and were trying to stretch out their formula. So this isn't this sort of esoteric risk. This is an actual thing that happens with families.
Okay, thank you, Dr. Hancock. Lamont, did you have your hand up? Did you have a question? Is that a no?
No.
Oh, okay. Okay, I thought I saw your hand up. Okay, so as I mentioned earlier, there is a list of sites. They're called sites that have refrigerators around Maryland and DC that have what are called bottles of Enfamil baby formula, and these 10 sites there have been more than 100,000 bottles of Enfamil that has been distributed between these 10 sites for free pickup. And I will share those locations with you very shortly. Are there any other questions for Dr. Bodrick or anyone else? Please share right now. If not, we will go to our next guest speaker. And I'm delighted to have, and thank you, Dr. Bodrick, for coming on at such short notice. But we're going to continue to move forward and try to deal with the health of all of our community, including our mothers and our newborns. And I think that with the legislation that council members passing and with what's going on nationally, you can look to see a relief and more availability in about 4 to 6 weeks. That's generally the timeline that has been estimated nationally, 4 to 6 weeks before you start seeing normalcy on the shelves in terms of availability of baby formula. But without further ado, I want to introduce Dr. Akil Dr. Akil Prayler. And Dr. Akil Prayler is a naturopath doctor, but she's also the mother of 2 children under 2 years old. And she can't show her face right now because she's actually taking care of her children She's actually breastfeeding her children right now. So Dr. Prayler, if you could unmute yourself and share with us your thoughts and your experience as well.
Hello, everyone, and thank you so much for having me. He's my uncle, so I love Ambrose. No favoritism shown there, but thank you guys for having me tonight. I'm going to speak just from an experience as a mom, not necessarily my naturopathic, hat on tonight, but obviously that's intertwined because I don't see any difference between both. So when the shortage began, or when it first started, I had no idea until, my friend posted something on Facebook. And that was because I had been breastfeeding since, I gave birth, which was 5 weeks ago tomorrow. And it was, kind of reminding me of when COVID first hit, where the toilet paper rolls were gone and the milk were gone and things like that. And I'm like, what in the world? But what I'm noticing is that, obviously the language that we use to inform people about, the shortage is what's driving the shortage. When you say that there will be fewer supply, or they're taking the formulas off the shelves, people are running to the stores to buy more so that they won't be without. And obviously a lot of concerns about, well, maybe you should breastfeed your children and things like that. I've had experiences from my first child who had a tongue tie, a lip tie, which made breastfeeding extremely difficult for me. And also I was still in school while I was nursing my child. And those who recommend, moms who have new babies, just go ahead and breastfeed, have some compassion, because for the most part, a lot of women in America, they're kind of not supported at work to breastfeed, in a sense, even though they have, nursing rooms for some women, and they have the ability to, schedule in some time to breastfeed. For me, when I was going back to the clinics, I had patients at times where I really needed to pump. So I was getting engorged and things like that. And eventually my breast milk supply had decreased. And so I was only able to produce about an ounce at one point for my child. And that's not enough milk for a day for a child at all. So some of the things that I had to do was to actually substitute with formula. I never used Enfamil or Similac. What I did use was Happy Baby Organics. And on the formula of the Happy Baby Organics, it does say that it's not intended for newborns, not intended for infants. And the reason being is because most of the organic companies, they support the natural breastfeeding. But once you consult with your pediatrician and you look at the nutrition facts, most of them have the right percentages and quantities of nutrients needed to support a baby. And my son, if you've seen him, at least my firstborn, he is huge. He's 2'10", 20 months. He is able to speak clearly, say hi. He can say all of his ABCs from A to Z. He has not had any issues with development at all. He's actually pretty advanced for his age. And so a lot of women are fearful that there's no more Enfamil or Similac, but there are alternatives to those. And I understand the individuals who don't have access to the organics, or who can't finance it. I will say that when I did use that organic formula, you can find that in Target. I found that they actually had fewer calories per scoop. So although they may have the same amount of servings, so they may say 22 servings per can, just like a Similac or something. If you look at the actual nutrition facts, they will have fewer carbs and fewer fat. And so whereas 1 scoop or 2 scoops for a Similac may have 190 calories per serving, 2 scoops for the organic version may have 150 or 180. And so that type of difference in the calorie expenditure would influence how much more you would have to buy. So that's why it kind of became expensive for me. I was still in medical school while I was, while I had my child. I graduated when he was 3 months, and his energy demands were quite high because he was I think in the 85th percentile in terms of weight. And so he, I found myself paying at least like $70 a week for his milk. And he would go through, I would say maybe two cans in a week and a half. And that is a lot. And so obviously the biggest issue for switching to like an organic alternative from infant milk and Similac would be finances. And if you don't have that, that's going to be quite strenuous for you. So unless there is some type of stimulus to help women pay for more milk to switch to the organic, I'm not necessarily sure what would be the result for that. But I know that although we have the shortage with the Similac and the infant milk, we do have other options, and they are in the stores. I've seen quite a few pictures that show shelves of infant milk and Similac gone, but the organic ones are still present. And I think that a lot of parents, they have issues with switching formulas. So some babies reject a new formula, like my son. I tried to introduce a pea formula to him, and he just did not accept that at all. And so that was $30 wasted. So I understand when moms are, quite fearful of trying to change the formula out, but I think that maybe working with a lactation consultant or the pediatrician to see how they can introduce a new formula to the baby if there is no other. But I'm quite excited to hear that they are increasing the amount of formulas available for moms who are in need of them, because that is absolutely necessary. Something to consider also, I'm about to go back to work because my 6 weeks are almost up. I was going to stay out for a little bit longer, but obviously with my disability pay, it's not enough to sustain me. And so, I am going back to work. The challenge for me would be to be able to pump on a regular basis. And I don't know how easy that will be given the, demands of work. But I'm hoping and praying that, having started a regimen for the first, I think I started pumping on the third day of birth because my son, Zamar, my second child, he has he has a lip tie at the top and the bottom. And that's something that's quite common among the African-American community. We tend to have gaps more frequently, or I think called a diastasis of the midline. So the gaps in between the two front teeth is common in African-American community. And that is a sign of a lip tie. People who have speech issues is a sign of having tongue and lip ties as well. And that's quite common in our community. So that might be a reason why a lot of African-American women kind of aren't so interested in pursuing the breastfeeding aspect of trying to resolve this shortage. But as far as moving forward, I would say there could be some better training with the doctors, at least the pediatricians, because none of my pediatricians diagnosed the lip ties. I had to go to a lactation consultant to understand what that was and know that, well, that can complicate the feeding for the baby. Even if it comes to introducing a bottle to them, those type of things can be complicated. And I think that that's about all I can share with my experience as a mom of babies who've had lip ties, and me having to introduce formula and choosing organic formula versus Similac and Infamil, and understanding that there's a financial strain when it comes to doing something like that could complicate feeding as well. And I think that's all I have to offer.
Well, you offered quite a bit, Keila, and I'm very grateful that you came on to offer your experience. It's not something that is discussed in great deal, at least not to men, in terms of the lip tie issue. I wanted to see if either Dr. Bodrick or Dr. Hancock could weigh in on that, themselves being pediatricians, and commonality of that, and how. And I'll go to. I think I'll also open it up to Dr. Michael Young as well, and bring her on maybe a little bit early. But whether or not you all wanted to comment on the lip tie issue in African American infants.
Lip tie is general. This is Dr. Young. How are you doing?
Thank you. How are you?
I'm all right. Lip ties generally don't affect the latch on the breast, but it can be a challenge when they're switching to nipples. However, tongue tie is a whole nother element that can interfere with breastfeeding. I do recommend babies get seen. That's something we should be assessing them for when they're breastfeeding. They're having trouble with latch. And Dr. Earl Hartley at Georgetown is my go-to otolaryngologist, pediatric ENT, who is a major breastfeeding supporter. He has a IBCLC in his office as well, and he is the one that I have sent patients to who have trouble with lip ties and tongue ties, and he gives a great assessment.
Okay, thank you, Dr. Young. Dr. Bodrick or Dr. Hancock, is that something you go weigh in on?
Sure. What I would say, it's not necessarily specific to African American babies. Tongue tie is a very common pediatric issue. It's usually initially identified, at least it should be in the well baby nursery prior to discharge, because that's when feeding is first assessed. And then if it's somehow missed or not really addressed, it's what happens in the first visit. We see a baby after discharge, usually at 2 to 3 days of life. I know in my own practice, I see patients out in Upper Marlboro now, and I put a glove on. I do a mouth sweep to look to see if there are any attachments. Just a month ago, a baby had a tongue tie that was not picked up in the nursery. We were able to refer them out and assist. And the reason why it came up was in talking about breastfeeding. I agree that there should be more training particularly in pediatric residency, related to breastfeeding and how to support a new baby and new parents, so that if there aren't conversations that the parents bring up about challenges with breastfeeding, it certainly is something that we should be discussing. When we talk about the impact of these issues on African American women, what I would say is there are a lot of issues, and I'm sure the good doctor will go into some of the challenges related to Black women in breastfeeding, but it's more the social determinants in terms of breastfeeding as opposed to anatomical challenges. And that is supported spaces in work. It's only having 6 weeks of paid leave. We know in this country, only 1 in 4 babies is exclusively breastfed up through that 6-month mark. And so it isn't just feeding challenges, but it really is societal support or lack thereof with mothers, particularly Black mothers, in terms of us being able to have safe spaces for us to be able to either pump or breastfeed our babies.
Thank you. Dr. Prayler, if you can talk a little bit about the organic versions, and if there's anyone that could talk about the alternative payment structure for parents to get organic formulas, especially if there is more formula of that kind available.
I can only speak from what I was able to purchase. So the one that my go-to was Happy Baby Organics, and that is found in Target and some grocery stores. Not everyone sells them, which, can be a complicating factor for some people. I do know that Target, like I said, they will give like a $10 gift card if you purchase 2 or more of those brands. It's really just how they manufacture it, and the products that they use that make them organic. But also, like I said, a lot of the organic versions, they don't have that added sugar, so they're going to have fewer calories than the other ones that do have added sugar. Some of them have added sugar, don't get me wrong, but they don't use fructose and things like that, high fructose corn syrup and stuff like that. So it does affect the calorie content per scoop, which means that it's going to affect how much energy the baby will be able to get from that specific meal. So that means that you may end up spending more money for to have an equivalent satiation for the child. So that's something that I would, just look into. I always would read how many calories per 2 scoops was available, and I would definitely see a difference that in the organic ones that, like I said, Happy Baby Organics was one of them. I also used some organic goat milk from Amazon when my son got older. He was about, I want to say, he had to be 11 months because at his daycare, they were asking that we give him something with more fat in it. So I gave him organic goat milk formula. And on Amazon, the good thing about them is that you can buy those in bulk and they'll tell you when it's EBT eligible. So that is good. I bought about 12 cans, and my son, again, he will go through those cans so fast because his energy requirements were just a lot higher. So for moms who are able to purchase organic formulas, definitely consider looking on Amazon. And like the pediatrician stated, make sure that they are FDA approved and things like that, made from the States, or have been at least evaluated by the FDA. Some things like supplements are, and most formulas are considered supplements, which is why people can't get them from EBT or with the EBT. I found that out when I was in school because I had EBT and I was on Medicaid and things like that with my firstborn, and I was trying to purchase some formula that wasn't purchasable through WIC with my EBT, and because it didn't say nutrition fact but supplement fact, it wasn't able to be processed through the EBT. So there are some formulas that are organic that can be processed through EBT, and on Amazon, like I said, they will tell you which ones can be. It just depends on how it is being regulated.
Well, that's also good information, Dr. Prayler. And I know that up next, we're going to be having 2 people from the DC Department of Health, from the WIC program, talking about
soda and water. It cleaned it up. It loosened it all up. It was stuck.
And so I just wanted to make sure that everybody knew that we're going to talk about the issue of what WIC will allow and authorize, and how one can do that. And if are there any other questions for Dr. Akil Braxton Prayler? And if there are none, if there aren't any, raise your hand. If not, then we'll go straight to Sarah Beckwith and Odie Botang, both from the Department of Health. Odie is over the WIC program for the Department of Health for DC. And Sarah Beckwith is over the physical. I'll let her introduce it. It's physical. I know it's physical and nutrition. I think it's something, if I read it right. But and I know Sarah, worked with Sarah before, and we're glad to have you, Odie. Can you all talk about what we just got finished talking about, where one formula might not be on the WIC list, but on the EBT list, and how we can reconcile those things, how if they're reconcilable at all, and just what people need to know about WIC and how to get approval for WIC. So Sarah and Odie, you can both unmute yourselves and begin to talk about that.
Sure thing. Thank you, Ambrose. Thank you, Lamont. Thank you for everyone who has joined us tonight to talk about this important issue. We actually have a PowerPoint, Ambrose. I wonder if you could allow me to, great.
Give me 1 second. Okay, you should be able to share your screen.
Okay. We love a good PowerPoint. Okay, got it. All right, let me go to slideshow. All right. So good evening, everyone. My name is Sarah Beckwith, and I serve as the Bureau Chief for the Nutrition and Physical Fitness Bureau at the DC Department of Health. And I am joined by my team member, Akua Odi Boateng, who serves as the WIC State Director. This is our DC Health vision and mission. So this slide is a complement to the background that Ambrose gave us. And you can see over time that there has been an increase in formula shortages in retail stores over time. There actually were pre-existing shortages due to supply chain issues and labor shortages due to COVID. And then there are 2 points in time that we have pointed out. In February, the Abbott plant in Michigan, it closed due to the suspected contamination. And you can start to see an uptick in outages, in shortages. Then around May, I think all of us started to see an increase in media coverage. And then we also started to see an increase in panic buying and hoarding. Ambrose talked about some actions that have been taken by the Biden administration, by Congress. The overall message is that this is not going to be a magic wand, and it is going to take at least 4 to 6 to 8 weeks before we start to see adequate supplies on all retail shelves. Just a few notes on actions that DC Health has taken. So Council Member Nadeau talked about a letter to pediatricians that DC Health, we sent out over the DC AAP's listserv on last Friday. This was to give pediatricians some standardized messaging on information they can give to families. We're going to send a similar letter out to all of our partners. So we are happy to send out this letter to everyone on this call. And this will be some standardized messaging that partners can give to residents that they serve. And then DC Health is also working on a sort of frequently asked questions webpage that we will upload to our DC Health website for parents and caregivers, so that we can also have an online resource for parents. So now to talk a little bit more about DC WIC is the expert, Odie.
Hello everyone, my name is Akil Prayler and I'm the DC WIC Director. I first want to start by introducing the WIC program a little bit more. The WIC program is officially called the Special Supplemental Nutrition Program for Women, Infants, and Children. It's a federal program run by the U.S. Department of Agriculture, and it's usually administered at the state level and is state specific. So that means that even though it's a federal program, you have to apply for WIC in the state that you live in. That is very important in our area where everything is close together. And someone may think, oh, I can apply for WIC in Maryland or Virginia, even though I live in DC. If you live in DC, you should apply for WIC in DC. WIC is very integral and important to all families in the US. About 50% or more of children born in the United States participate in the WIC program at some point or the other in their first